Hi, I'm Dr. Maya Webisode. My friends and patients call me Maya. I hope you will too.
First question comes from Anonymous in Menifee, California. He is a male, 23 years old, and asks, Dr. Maya, my girlfriend wants me to give her anal sex. I know you cannot get pregnant from anal sex, although I will still wear a condom. I just want to know if there are any health issues for her or me.
Great question, and all I want to say is that of all the sexual acts, anal sex is the most misunderstood. The anus carries a lot of nerve endings, so it becomes one of our most intense erogenous zones, and so anal sex could be quite pleasurable. But with that said, it does carry some risk factors, and one is that the anus does not provide as much lubrication as the vagina does, and that the skin inside the anus is very sensitive. Both those items combined could lead to tears once penetration occurs. And through these tears, you could pass all kinds of things, STDs, HIV is seen as being transmitted higher in anal sex than any other form of sex. The other thing is that in the anus, there's a sphincter that's a muscle, and it holds our feces. So it tends to be very tight, and with multiple penetration, it could loosen. And what we need to tell people is that there's exercises that they could perform to help tighten that sphincter and to avoid that.
Are those the Kegel type of exercises we discussed earlier?
Yes, Thomas,
okay.
That's exactly it, the Kegel exercises. Okay. Then the last thing is that the anus is just full of bacteria. It's not necessarily STDs, it's just bacteria. So you could easily transmit infections like urinary tract infections and vaginal infections. So once again, the biggest tip is to wear condoms and to change your condoms whenever you're inserting your penis into the mouth or the vagina after having anal sex, and to use plenty of lubrication. And then the big red flags are if you start bleeding, or if there's discharge from the anus, or there's any lumps or sores in that area, you should definitely see your doctor. And again, remember, you should stop if there's any pain.
JG in Drain, Oregon. He is a male, 43 years old, and he asks, Dr. Maya, does non-activity and isolation cause depression?
Well, first of all, I want to say that depression is a big medical condition that we know involves a lot of different symptoms, but the overriding symptom is extreme sadness, where it interferes with your daily activities and relationships. And we know there's a biological basis for depression. It is seen by an imbalance of our neurochemicals in our brain. And these neurochemicals are things as dopamine, serotonin levels, and norepinephrine. And once we see the imbalance there, it could result to the symptoms of depression. But the actual cause of depression is really not known. We know there are factors that lead up to depression. There are primary factors, and one of them is just being female. More females tend to be depressed. And then if you have first-line family members that have depression, like your mother, father, sister, brother, and even your children. And then there are secondary factors that could lead to depression, and one of them is things like non-activity, the lack of exercise, or the other family members, like third-degree family members, and also lack of social isolation, like you have very few support systems. So it's very interesting. It's pretty complex, but yes, both those things could lead up to depression.
Dr. Maya, I am a 54-year-old woman named Faustina going through menopause. Is there anything I can do to lighten the burden?
Faustina, that's a great question. Most women are struggling with that. And first of all, I want to say that menopause is a natural thing. It's a natural transition. And that's when we start losing our hormones, which would be estrogen in particular. So some women do not need any experience any discomfort and go through it, sail through it pretty effortlessly. But some women do experience a lot of problems. So the way I look at it, if you have mild symptoms, which include hot flashes, insomnia, mood disorders, vaginal dryness, you could do some simple things. First thing for the hot flashes, you can wear layers of clothing, and you could take them off as needed when you start feeling the hot flashes. You could also use over-the-counter herbal formulas that help with that. And you could use like a wet, cold towel and put that on your neck, and that helps you lower your temperature. You could also stop smoking and stop drinking. That helps lower the hot flashes. And for sleep, it is recommended that you sleep at the same time every day and that you don't take naps, because that really doesn't help. And for the mood disorders, there are just simple things like exercise and more activity and social supports, where you talk to other women that are going through menopause and going through all these terrible symptoms. But then there's another group of women that have really severe symptoms, and these symptoms, the same ones we talked about, but at a very severe, intense level, and it affects their quality of life. So for them, there are medications, there are hormone replacement therapies that replace the estrogen and the woman is losing. With these medications, there is substantial risk, and the risks are relating to heart disease, breast cancer. You could even develop clots. So I don't recommend them right away. We have like a discussion between the women's individual symptoms, and then we come at a conclusion. If these symptoms are very severe and affecting their quality of life, and they just can't stand to live another day, well, yes, you know, they should start on these medications, and I start them at the lowest dose for the lowest time possible to minimize the other risk that we talked about. And you know, it's always a combination of things, and I think we're all here to try to make people's lives much more comfortable and enjoyable. So if you're having these symptoms, please see your doctor as soon as you can.
And our last question for today is from a 24-year-old viewer. She asks, Maya, she's calling you by your first name, which is fantastic, what you want, your friends and patients to call you, that's wonderful. She says, Maya, what is the bottom line healthy decision on the HPV vaccine, in this case for her teenage sister, but really for any teenager?
Well, first of all, let's talk about HPV. It is the virus that leads to genital warts and cervical cancer. And there is like a whole multitude of strains that we know of, and about 40 strains affect the cervical area. And it is very prevalent. It is transmitted by skin-to-skin contact. So condoms aren't 100% when you're, you know, going through sexual intercourse, because you could transmit it from skin to skin, and the condoms don't cover that whole area. So therefore, it is estimated that about 80% of sexually active people will be infected with HPV by the time they're 50 years old. Yes, and so that usually occurs in a very young age group. The age group would be 15 to 25 years old. That's when they're affected for this first time. And these vaccines are geared for that age group. So the United States recommendations are that any girl or woman from the ages of 9 to 26 be vaccinated with these vaccines to prevent cervical cancer. There are two of them. One's called Gardasil, and it protects you against the strains of 6 and 11. Those are the ones that cause genital herpes. But then 16 and 18 are higher risk, and they cause cervical cancer, so it protects against those also. Then there's another vaccine called Cervarix, and that protects against 16 and 18, and then the other strains will be 35 and 41, which are high risk towards cervical cancer. So like I said before, it is recommended. It is also recommended for boys between the ages of 9 and 26 for the same reason, to lower the transmission of genital warts, and then to lower the transmission to their partners of cervical cancer.
Why don't we hear this issue brought up so much with teenage boys as opposed to women? Is it more prevalent in females?
Right, but just recently, these recommendations for the boys just came out recently because they felt that they could prevent the spread of this virus by also utilizing vaccines in that population.
Wonderful. And last question on that, follow-up question is, why is this issue so polarizing amongst people? Can you elaborate on that, or do you know?
Well, it's good and bad. I think we're becoming much more vigilant and educated on what vaccines could do for us, the side effects. But studies and research show that these vaccines really do help, and that's why doctors are all on board in recommending these vaccinations to prevent these chronic conditions.
Enough said. Thank you very much. That's all I have for today. Thank you, Maya.
That's great. Thank you once again for all those wonderful questions. Please remember to send all your questions to drmayand.com, and I promise that I will personally answer each question. If not on the show, I will personally email you the answer. That's all for now, and I'll see you shortly in another episode of Ask Dr. Maya. By the way, my friends and patients call me Maya. I hope you will too. Bye for now.